Following on then to item 5. So this is an update report on the work, particularly around how we tackle the issue of mental health with our partners. And again, just to give a little bit of context before I ask you to give an update on this. Obviously, it all relates back to the police and crime plan around the priorities around working with vulnerable people and looking at how we address mental health in particular within that. And obviously I know that within the report it does make mention of the West Yorkshire Criminal Justice and Mental Health Forum, which was established through this office, that's brought a number of key partners together, including of course West Yorkshire Police, the NHS, Public Health England, Ambulance and Fire Services, the Mental Health Trust and British Transport Police, and importantly the third sector. So obviously a number of initiatives have been taken forward through there which feed into this update. So I'll go over to thank you.
Commissioner, thank you. So again, by way of introduction, priority area within the police and crime plan, what we're going to outline is West Yorkshire Police's contribution to trying to improve issues where people are suffering from mental ill health. Obviously we had the announcement today of some significant government funding that is going to be directed directly into mental health provision, which should in principle assist us, particularly where we may have to detain somebody in terms of places of safety. I know Fran's going to touch upon some of those numbers, but I think the announcement today has been incredibly helpful and very promising, bearing in mind some of the work that we're already doing. So, Fran, do you just want to outline some of the things that we're doing?
Yes, our officers obviously deal with mental health incidents in lots of different varieties of ways, whether that be call to a victim, an offender, repeat callers. But just to focus our attention really on the use of Section 136. So that's exercising our power to where someone needs immediate care and control to take to a place of safety. We've done significant work in that area over the last few years. And whilst the number of incidents has increased slightly, we're pleased to say the use of custody is significantly reduced by about 25%. So whilst officers are exercising the power, there's about 90 people per month are taken to a place of safety, where there's about 10 people per month taken to the police station. So, and that's reduced in the last year from about 14 down to 10 per month. We'd like to see that reduced further though, but we're confident that that can happen because we've seen the reductions already, and we just need to focus our staff on the street triage that we have available and the 24 access to mental health practitioners, as well as our control room facility. So when officers are presented with somebody that has these mental health problems, they can and should speak to a mental health practitioner, because it might be that they don't need to exercise those powers and that they can just get that advice and we can take an alternative route. But what is important is that they do take the route to the health place of safety. Luckily, we're fortunate enough at peak times to have nurses in the control rooms, and that can help with that signposting to go to the place of safety. But it can also help with actually live incidents that are ongoing as well. For example, missing persons or domestic abuse incidents, where they can provide that background information that means we make a better risk assessment and then take that person to the right place. I think we're all agreed that we don't think the police station is the right place for somebody with mental health issues, and also when the police and crime bill becomes an act, that won't be possible in a lot of cases anyway. We're going to have better data collection. So on the handheld app that officers have, their pocket notebook, they'll be able to actually record how they're dealing with these incidents. So we'll be able to actually see how long they are taking and get some better recording methods, so we know how they're dealing with that and understand the full impact. But we need to equip our officers with dealing with these sort of incidents and make sure they know the facility we do have. So we're having a training programme which is going to be rolled out force-wide in the autumn, and all officers will have 1 day's training, which is not just about sort of the act and the law and the new law that's coming in, but also about why they're doing things and how individuals might present to them and what the best action would be for them to take in the circumstances.
Thank you. Thanks for that. And firstly, just to say, you know, I mean, I know that some of these cases are difficult for frontline officers to deal with. And, you know, I don't underestimate, therefore, some of the circumstances in which people find themselves. So I'd just say that up front before sort of asking any questions. Obviously, you've mentioned about the legislation. So it's really just to ask, do you feel that working with the NHS particularly, will we be in a position to meet those legislative requirements, i.e. that police cells are no longer to be a place of safety for under 18s and for adults, only in exceptional circumstances?
Yeah, and you mentioned earlier that the Criminal Justice and Mental Health Forum that is set up and yourself chairs, and we've been doing work over the last year to prepare for the bill coming in, and we've been asking districts with their mental health colleagues and the district leads, are they ready for this, are they match fit for when this does come in, and with College of Policing guidance as well, trying to get us, steer us to that place. And like you say, some of the things that we can't do, we cannot take children to, not only to custody, to the police station at all, won't be a place of safety. And adults, like you say, exceptional circumstances, whilst we don't know the detail of the bill, that sounds exceptional in itself, rare. We don't want to be taking people to the police station. Mental health assessments will have to be within 24 hours rather than 72 hours. So, you know, real challenges for our health colleagues. As well as being able to accept violent patients as well, and have they got the staffing requirements. So whilst our health partners have told us they are ready, we did think we need to test this out. We've had a case study event last week where we've gone through some previous cases, but we've actually talked about them in relation to, well, if that was today, would we be in a place to take them to the health place of safety? Would we be ready for the bill? Yeah. And overall, I think people are ready and getting towards the bill, but I still think there is room for improvement with both sides where police, we need to communicate, we need to use our mental health nurses to inform our decisions, and we need to make sure that the staffing in the health-based places of safety, that we are sure that they have sufficient, which we're working towards as the bill comes in.
Yeah,
I think this is complicated, isn't it? Because it's a systems issue. And there's two key factors here for me, Commissioner. The first is the volume. So we are seeing far, far more cases, sadly, of people presenting and reporting suffering from mental health crises across a variety of reasons about which the police do get involved. And of course, people's awareness is getting far, far greater, and more people are willing to talk with confidence about mental health, which is a positive. Yeah. The challenge that we then have is that readiness and capability. So I think we will have the capability because everybody is working very, very hard at coming up with some solutions. The concern I have is whether or not we will have the capacity to deal with the volume. And that is going to be something that we have to work out through the partnership. Let's take the opportunity of this announcement today and see what that could mean for West Yorkshire, given our profile. And of course, at the end of the day, we have to try and anticipate and predict where we think our capacity issues may arise and have some conversation to be able to bid for some of that funding to help us address the very question that you've asked us.
Yeah, and I think the report, you know, obviously sets out the demand. So outside of London, I think we've pretty much got the highest per rate of 1,000 population. The good news is you'd be aware of the Becklin Centre in Leeds. It was opened for a facility for children and young people, and the Haven in Bradford, which is now there. Also, I can say that I've just only today agreed to continue some match funding in Leeds around the mental health nurses in the call centres. And I'm aware that the liaison and diversion schemes are to be extended into other districts as well. So I think that there's an awful lot that we are doing collectively around this. And I guess one of the other questions is then around the role of the voluntary and third sector in providing more options around, you know, obviously the issue of trying to avoid the use of Section 136, and do you think there's more to be done there?
Yeah, I think there'll probably be always scope for more third sector agencies to assist. It's never going to replace when you've got to crisis, but it's actually to prevent us getting to that crisis, to provide that early intervention, so that they can catch people before they have that greater need. We know there's even voluntary things like the dementia cafes that where, you know, that builds up a network for people where they can go to each other and actually prevent getting to that crisis stage. So third sector agencies are invaluable, and perhaps just needs to look that we have sufficient coverage as the new bill comes in as well, so that we've got a help at all levels. Yeah,
and you talked about the training. So moving forward, will you be confident that frontline officers in particular will be aware of the help, if you like, that's there in terms of the referrals or the assistance around, you know, mental health nurses, liaison diversion, etc.
Yeah, that training will cover that. I think the knowledge of officers that the context of mental health and the nurses is quite good. We just need to reinforce that, and as we've got new officers coming through, we need to make sure they are completely aware of you know, who the point of call before they make that before they exercise the power of Section 136, and to go to that health base of safety, but then you know that's the right thing to do, because sometimes obviously the mental health risk assessment, they can give us far more information to make that better assessment than just police alone.
Yeah. And I think to complement trying to raise that awareness about members of the community experiencing mental health crises and what to do, we're also having internal conversations about our own staff and people, and not having the concern about raising the fact that they themselves might be suffering from some kind of anxiety or stress or mental health condition, so that we can raise awareness and look at early intervention and prevention for our own people. I think that's incredibly important in terms of the wellbeing agenda.
Yeah, no, I think you've preempted and probably answered the other question around, it was around, concern for our own staff, who may well develop some mental health issues as a result of, you know, some of the work that they do.
So there's been some pioneering work led at Leeds and Kirklees, I have to say, in the first instance of a group of willing volunteers who've come together to form a support network. That in turn has helped us to sign up with confidence to the Blue Light programme. We've had Mind coming in and delivering sessions that last day. I've actually attended one myself to raise awareness within individuals to go and have the confidence in terms of those conversations. So I think that is starting to really grow. And then hopefully we'll address some of the concerns and provide support way ahead of one of our officers or staff sadly reaching a crisis point.
Well, that's thanks for that. That's good to hear regarding the access and availability of that for all our staff as well, if they need it, of course. I don't have any further questions, but you know, thank you for quite a detailed report, setting out all the different things and work streams that are in place, and I think we're absolutely on the right trajectory to really address you know, the issue of the places of safety and the use of Section 136, accepting that, you know, it is always a complex and challenging area to work in.
You know, I'm really grateful for the hard work that our safeguarding teams are doing, our district teams are doing, our partners are doing, because we're having far more constructive and positive conversations and discussions around this now than perhaps we've had ever before. And we've got fantastic support from some of our partners as well, so I'm really grateful for that.
Thanks so much. Thank you.
Thank you. Thanks.
Okay.